We're then going to go into a series of questions for candidates, candidate audience Q&A. To these notebooks, communities, and we want some random questions now. So do 30 minutes, panel session, one of about 20 minutes in Q&A, and then Shink will do the same with the same parents, and then be with them. We will bring a guest out here now. She's going to lead us with another grounding exercise. I think that's really important for us now. But I personally might talk about my trying to set the space into our bodies. Because this lamps our abilities to find it and serving it. All right, so well, no. Something that we like to do at ICPJ. We really just want to bring everyone experience to plants.
And communities and single payer healthcare, which if we're going to do in the state, we need to do it right. And also if we're not doing it in the state anytime soon, then we have to do it here, right here locally. And so I do want to bring attention, there is a ticking time bomb coming with the Trump and Senate cuts to $1 trillion to Medicaid and 230 to 295 billion from SNAP. And so that is being enacted January 1st. And we are going to see the fallout from that, especially in communities like Ypsilanti that are working class, that are diverse, that have a high percentage of poverty rate here. And so I want to bring a light to a proposal for the Washtenaw County Plan. Some of us don't. But I credit the Washtenaw Health Plan for my health today because I was able to get all of my needs met then. So I think this is a really incredible opportunity to meet the moment when our federal government is attacking our communities. And we need to support the millage for the Washtenaw Health Project's health plan.
Thank you so much. Amy.
Mental health is one of the biggest community health challenges, and it isn't just about individual choices or individual access to care problems. It's about all the things that we've been talking about: stable housing, social connections, safe neighborhoods. And what we can do as a city is not run clinics or provide these services directly, but we can shape the community that people live in, and we can support parks and libraries and rec programs and neighborhood events and all the ways that people can connect to each other. And all this combats the worst causes of mental health, which is social isolation. And when people have these connections and when they have stability in their housing and in their job and in their life, they don't need so much of this from professionals. They get it from their neighbors, they get it from their friends, they get it from their community as a whole.
Thank you so much. Commissioner LaBarre.
Thank you. I'm on the community mental health, the 2017 millage that we have that brings in 30% of the mills full mental health services on the town. That's a good thing. That's a good step. We need to enhance what we do around Washtenaw County CMH. We have recently funded over the last several years the creation of a youth advisory and resource center that will provide holistic service to youth in contact with county government, including and primarily the needs they have a CMH. Proactive things are great. Right now, our biggest challenge, actually, which Councilmember Fellows mentioned, is playing defense in terms of what they did with their most heinous cuts in the one big bill. We have 12 to 18,000 people in Washtenaw County who are at risk of losing health care as a result of that. That includes both mental health services, but also just basic health care. Right now, playing defense and trying to fill those holes as best we can. That's our best bet. And then as we dig out in the years ahead, I think we can make more proactive federal and state changes. But right now, playing defense at the county level is probably the best we can do in the short term.
Thank you. So we're going to go into this question about health equity. And this has been alluded to a lot in answers, and then also in conversations that, we've all been having in this community. But we know that the people who experience the greatest barriers to healthcare are often the same people who face barriers in all other parts of life. So this is Black folks, immigrants, queer folks, people living with mental illness, people who are or have been incarcerated, and others who have been intentionally and historically excluded from decision making. How should those realities shape the decisions that you?
Great. I'm going to actually answer both questions if I can in 2 minutes. But I think the first thing I want to say is, first and foremost, it's putting those communities at the decision-making table because they've been historically excluded from decision-making. They deserve to be the ones that are making the decisions, especially about their own health care. Folks, we need the community at the decision-making table in order to make the right decisions for our community. The other thing I want to say is, we have to think of ourselves regionally. In Ann Arbor, I'm speaking as an Ann Arbor resident and as a county commissioner that's represented the city of Ann Arbor as a commissioner and then a state representative. We also think of our community as being an island, right? We think of the highway as this boundary, this moat around our community. We have to break that barrier down. We have to think of ourselves as a regional community. We have to work with Ypsilanti and Ypsilanti Township and our whole county, or else we are not going to be successful when it comes to health, when it comes to environment, when it comes to so many other things. And so part of why I'm running for mayor is because I want to create a regional partnership on health, a regional partnership on the environment, a regional partnership on all these things that when we are siloed, we can't do as well. And being siloed, honestly, is what the billionaire class wants us to be. They want us to be divided and fighting amongst each other and not getting along and working together. We have to break those barriers down. When it comes to mental health, I want to see the city of Ann Arbor actually investing the mental health dollars that it receives, public safety mental health dollars that it receives from the county, in public safety and mental health. I wanted to put those dollars in our community to help support those in our community that are suffering the most. The Washtenaw County has a program to do direct outreach to folks in our community. The city should have a program too, within city government, not privatized, within city government, to do direct outreach, to do social work out of streets of Ann Arbor, to do mental health care out of streets of Ann Arbor, and make sure people get the services that they are entitled to.
Thank you. All right, Amber.
Yes, to regionalism, we need to work together to get all these things done. So, I also want to talk to mental health again a little bit more. So, these questions make me think about very tangible situations that happened in Ypsilanti. There was a 30-hour police siege on Cobb Street. Ruben Peeler was experiencing a mental health crisis, and in a time of need that he needed care the most, he was met with torture and terrorism from our own public safety. And, this is something that has really driven the community to push forward on the idea of having an unarmed crisis response, community responder program. And I'm proud to say I wrote the resolution to fund that at nearly $1 million with community support for both the community responder program. We've also funded public restrooms, public drinking fountains. We are making moves in Ypsilanti now, and we are trying to respond to some of the things that the community has been demanding for years and years and years. I also want to talk about a little bit about what's going on at the Huron Valley Women's Prison. 3 women have died recently, all in 1 month, and the issue of Crystal Clark, who is scheduled to have a possible parole in 11 months, she's fearful that she might not make it out by then. So, when we're thinking about the equities, we have to, includes policing at our prison system. The carceral system is driving down our social determinants of health, and it is segregated by zip code and by ethnicity and all those overlapping structural issues. So if we're going to be serious about this, we have to attend to the issues that are hitting the most marginalized people the most, who are dealing with mental health issues, who are often in the homeless community, who are in prisons, who are have interactions with the police, and we need to create alternatives.
Thank you so much. And then, Andy, if you could speak to this, not how those realities shape decisions if you are elected, but how do those realities shape the decisions you make as an elected official?
Sure, briefly. The county created in 2017 and then put in place in 2019 the Racial Equity Office. That was an intentional structure within county government to inform each and every board decision with a lens as it relates to racial equity. It is an imperfect tool, but it is a very good one. It's one that other communities should build on. We also at the county have, I think, a proud tradition of community engagement through the board process, and specifically board created committees. Those are particularly of value here in terms of when we talk about things like with the mental health millage, we have the millage advisory committee. With our newly created older adults millage, we also have the senior commission that we've created. Those allow for direct input from residents, and they allow for an iterative back and forth as policymakers look at implementing millage dollars, navigating federal funds and state structures, hearing from the community directly in terms of what's working, what's not, and what we need to change. So I think those two structures are ones that are useful at the common level, though we can always do more and seek to do so.
Thank you. So, folks, this is going to be a question. We're just going to go straight down the line. You can start with anything and just pass it down. But this has been a question about, for y'all, where do you believe that county and local governments have the greatest opportunity to improve the health of our community?
Yeah, I talk a little bit about the two things that I think that are the most important to this is getting people moving and making sure that people are living lower stress and just healthier lives in general. And the way we can do that as a city and a county are to break down these barriers between communities, and so that people don't live just in Ypsilanti. Their lives extend far beyond the borders of their municipality, and having the connections available in transport and in just community life in general, and like cross those boundaries and like fill their whole lives. Seems to be the most important thing. And then the housing, making sure that people aren't living in molds and they actually have like things to do with their lives. Something that people talk about in Ypsilanti a lot is there isn't a whole lot to do here. And I'd like to see people not have to leave and go to Arbor and try to get these things that make their full life. Because a lot of people don't have access to the transportation that they need in this environment that we exist in. It doesn't have the public transport to get to these places. And we're lucky enough that we do have it for the most part between Ann Arbor and Ypsilanti. But yeah, we need more regional services like that.
I'm going to start by talking about a few of the things that I have been able to accomplish as a county commissioner. I was able to help lead the creation of the Washtenaw Dental Clinic, which is just located nearby here. That is a location that is accessible to anybody that doesn't have access to dental.
Have access to the transportation that they need in this environment that we exist in that doesn't have the public transport to get to these places. We're lucky enough that we do have it in, for the most part, between Ann Arbor and Ypsilanti, but yeah, we need more regional services like that.
I want to start by talking about a few of the things that I have been able to accomplish as a county commissioner. I was able to help lead the creation of the Washtenaw Dental Clinic, which is just located nearby here. That is a location that is accessible to anybody that doesn't have access to dental care. They can get dental care from the county here. I helped to create that. Also helped to create the countywide transit plan that led to the creation of the Regional Transit Authority that is now AAATA, that includes Ypsilanti Township, and the city of Ann Arbor. I also helped to create the foundational framework for the Regional Transit Authority. So transit is a very big issue for me and something that I care deeply about. Also, as a county commissioner, we made sure that Planned Parenthood was funded. Planned Parenthood is an important asset to our community, and they're under attack right now. We need to look at ways that we can support and continue to fund Planned Parenthood as an entity that can continue to provide services to our community. I want to use the rest of my time to talk about housing. Housing is a human right as well. We need to make sure that everybody has access to housing.
We have 850 people in our community right now that are experiencing a lack of a shelter and that are homeless. We need to make sure, if you believe that housing is a human right, there are 850 people that are experiencing homelessness right now. That means we're violating the human rights of 850 people in our community today. And if we believe that we are violating the human rights of those people, we need to take action to house them. I believe that everybody has the right to shelter, and we need to build the facilities or buy the facilities to make sure that people have that right taken care of. We need to build unprecedented amounts of publicly owned, permanently affordable housing to actually house people that are working class, seniors, middle class. And we need to make sure that that housing is provided in the immediate term, not in 20 to 30 years, but now. And we cannot achieve that through trickle-down housing. Building housing for the wealthy is not going to build housing for the rest of us.
Okay, what can local representatives do? We can fund the Washtenaw Health Plan now, and we can work to pressure state representatives for single-payer healthcare, state level, MyCare. We can build housing, truly affordable housing to people that actually live here already. We can make free fares for our public bus and transit system. We can improve routes, and we can launch an unarmed community responder program and create public restrooms that are accessible to everyone. We also need to create jobs and more connectivity to job hubs. I'm proud to say I have pushed council to do a D2A2 stop survey so that we can potentially create a new bus rapid transit stop in Ypsilanti to Detroit and Lansing, so we can finally have our communities connected regionally, so we can do these things together, because we're going to be able to work on these things only if we do them together. Thank you.
Thank you. Can y'all pass that on down to Andy?
I think right now the biggest thing county government can do does relate to what's going on with the Washtenaw Health Project. There is a 0.2 mil proposal that may be on the ballot in November that would provide 3 years of funding that would be split up into 3 different purposes. The first is respond to the disaster that they're creating with One Big Beautiful Bill around Medicaid enrollment. That's going to hit this community particularly hard and interplays with all that the Trump administration is doing to terrorize our immigrant community. The second component is general public health, community workers, and outreach. As we saw in the pandemic, when that hits the fan, it's a massive problem for any and all community members, and that is directly assaulted with One Big Beautiful Bill. Then the final one is reproductive healthcare services. As Commissioner Rabhi mentioned, Washtenaw County has stepped in to fill the breach on reproductive healthcare services in the past, but that hole in the wall is just that much bigger with this bill. So right now, in the 3-year window, from the county perspective, I would say that is the biggest hands-on nuts and bolts thing that we can do to affect change at this and to make change impactful at the local level.
All right. Thank you, folks. Also, I've never been prouder of a group of panelists because we started behind and we are on time. And I would just really like to give this group of extremely vocal people their flowers for being able to stick to 2 minutes. Because I'm going to be honest with you, it couldn't have been me. All right, so we're going to start with questions. I want to acknowledge, too, that we do have, Emily has been our amazing chat moderator. We do have a community of people who are online as well. So online folks, if you want to surface up your questions, we'll try to get some of those asked as well. So we're moving into our Q&A time. Again, if you have a question, if it comes to you later, those kinds of things, I really encourage you to contact these folks' offices and follow them around to everything that they are doing. So when you get ready to go vote, you feel like you've gotten a chance to get your questions answered. This first question is for Yousef. It says, can you address what Ann Arbor and the county can do about toxic threats like PFSAs, the Gelman plume, and use of herbicides and pesticides that get into our water and wildlife?
It's a great question. This is something that I've devoted most of my life to is environmental stewardship. And this is absolutely something that the city of Ann Arbor can take on head on. The first thing I want to talk about is the regionalism aspect of environmentalism that we need to be focused on. We are under a full-on assault in our community from multiple different industries. Data centers is one of them. We need to be standing in solidarity with the people of Ypsilanti Township, pushing back against the data center. We need to be standing in solidarity with the people of Saline that are, now experiencing the construction of one of the largest data centers in the country. And one of the reasons that I want to talk about why that's so important to us, I don't know if you guys saw, but Consumers Energy just recently announced that they're building a natural gas plant in Lima Township. And the fumes from that plant are going to spew over the city of Ann Arbor. So if you wondered why it's important to show up in Saline and Ypsilanti Township to make sure that data centers don't get built, that's why. You're going to be breathing the air from that data center toxic fumes. So we need to show up for communities all around us and approach this in a regional way. When it comes to things like the Gelman plume, groundwater does not know what municipal boundaries are. So we need to work with our regional partners to do it. But we also need to be bold and upfront about what we are doing to address that environmental contamination, that environmental disaster in our community. It's something I worked on as a state legislator, and I will continue to work on as mayor. I have long and consistently supported the involvement of the Environmental Protection Agency, which is something that the person I'm running against actually voted against the city of Ann Arbor engaging with. And so I have always supported the EPA being involved because they have tools that the state of Michigan does not have. I experienced this firsthand as a state legislator. The Department of Environmental Quality and then EGLE are ineffectual at actually holding polluters accountable because we don't have strong polluter pay laws in the state. When I was a state legislator, I sponsored the bill for polluter pay in Michigan. We need to be advocating for that to pass so that our cities and municipalities also have the tools they need to fight and combat pollution.
Thank you. Okay, this next question, and this is for anyone who cares to answer. This is, I have experienced poor care. I have not been listened to, and I have not been respected because of the color of my skin. How can you, in your office, address the racism present in local care?
Well, I'll go ahead. I have the mic. I don't have any personal experience with the skin color problem, but I do have personal experience with the gender problem. And I see this a lot. Like Yousef earlier was talking about systems that are not designed for the people using them. And like you said, there's an immense amount of value in having the people who are actually using the care making decisions on how it's designed. And so we need more people of color in decision-making positions that shape the way that this care is delivered. And the way we can do that as a city government is somewhat limited, but we can absolutely be advocates for that. And we all should be.
Thank you. We have probably time for one more person. Amber, you want to respond?
I think about this in the design of the community responder program. This is going to be hopefully a city-run program, a new service. And in order to get it right, we need to do it from the ground up, and it needs to be community-driven, community-designed, and it needs to be with equity and racial disparity and all the other things that contribute to these power dynamics and deep disparities in mind. So I look forward to seeding this as a project of what future healthcare services could look like from the ground up. And I did hear from Abdul Al-Sayed when he was in the town hall earlier, I think a week ago or so, that he spoke to the idea of community-seated healthcare hubs and funding that and seeing if that could change some of these systemic issues that have been driving a lot of the problems for a long time. So I look forward to seeing him elected so that we can try to do something different with our healthcare system.
Yousef?
Yeah, Gail told me I had to answer this question too.
I have a statement.
Oh,
I'm a black woman. That was my question because I was discriminated against.
I can repeat what you're saying.
Okay, go ahead. So
Gail, it was Gail's question.
Gail's question Gail used to work for Washtenaw County.
Yep.
Before they went to having degrees, and we were much better then than we are now as far as inclusion. Now we are top, and the people are not getting the information at the bottom.
So I'm going to repeat that question, and I'm going to try to answer it.
So
Basically saying that there's a lot that's happening on the top, but the people on the bottom are not getting the information that they need.
But I was at an appointment, and Jeff and Trudy were with me. And to have a white doctor belittle me and dismiss me, and that was a few weeks ago. And so as a senior citizen, I don't take no shit from nobody, if you know who I am.
Yes.
And so, of course, I went to the president of Trinity Health. So when you need to understand what is happening for real in this county for people of color, you need to have a conversation with me, because you don't obviously have enough information to know what's really going on here in our county. And typically people don't come out to these type of events to share their story. So
If we can push this into a question too that candidates can answer, I think part of what I'm hearing you say is, as a candidate, one, as Amber talked about, like, how do we deal with in the capacity of your office, right? And the limitation of the capacity of your office, but in the strength of your capacity of office, how do you plan to address racism in medical care? And then also, how do you make that an informed, community-driven decision-making process? And it's essentially, how do you incorporate the concept of nothing for us without us?
Great. Well, first of all, I want to thank Gail for the question. And my first experience meeting Gail was she invited me to talk about single payer healthcare at the Ypsilanti Library on Whitaker Road. And I got introduced to a whole group of people that I had never met before, people that typically were not involved in politics, that were learning and teaching me about the state of healthcare for them on the east side of the county primarily. And so I think the first and foremost thing that I can do as an elected official is do more things like that, where we are trying to engage folks that do not engage with the political system, who are not heard, who are overlooked, and whose voices are not included in the decision making. So it's about finding the places and spaces, as Gail has said, the places and spaces where people are having the opportunity to interact in a genuine way and speak the truth of what they have experienced. But I think an important part of that, is establishing the trust that what you take from that interaction will be acted upon and not forgotten about. Because I think that's why people don't engage in the end, is because they speak of what happens, and when nothing happens to solve the problem, they get disillusioned, they don't engage, they disengage, and then that becomes a cycle. So I think step one is having those interactions. And as I've been talking about at every stage of this campaign, I want the solutions to be community driven. Instead of hiring the big top dog consultants to come in and tell us what to do, the top dog consultants are the people who actually get the services, who are suffering from a system that is broken and racist. Those are the people that we should be putting in the decision-making seat to actually help guide the decision-making process. Frankly, it's going to cost a lot less than the millions of dollars we're spending on these consultants by engaging the community and building our programs out from the community up.
Thank you so much. So this last question is for Andy in your position as acting current commissioner, and then keeping in mind time, we will try to circulate that. But also, folks, this is a question that if you would like to answer it, you can submit it with your written questions, and it's actually quite simple. Why is there no homeless shelter in Ypsilanti?
I think the answer is there's not a homeless shelter yet, and I think there are a number of reasons for that, but the county is in the earmark process right now to try and secure funding to look at a shelter on the east side. I'm the co-chair of the Continuum of Care Board. We do have a shelter need in Ypsilanti, but we have a massive wave of homelessness services cuts that are hitting this country that will impact things beyond just sheltering, things from transitional housing, rapid rehousing, and others. So it's got to be a solution that has multiple parts. But this current iteration of the Board of Commissioners supports a shelter on the east side. The question always is, where is it going? Who is running and operating it? How are we paying for the construction or the acquisition? All those things. We're making progress, but more to come.
We have time for one. Amber, I was going to say, y'all can keep match for the mic on this. Okay.
To respectfully, with love, county commissioners, we need this. We need it in the city of Ypsilanti. This is where the problem is. This is where the rising homelessness is. We need that on the agenda. Our own county commissioner, Andy Somerville, has been in the way of this issue, has been a barrier. We need the other county commissioners to step up and get this on the agenda so we can start hearing from the public and actually making the pieces move, because what we want is a partnership between the city of Ypsilanti, the county, and the Shelter Association. The Shelter Association is on board. They have been meeting with the city. The county has not come to the table. We need you all to come to the table. We need a permanent shelter now. It is not the final solution, but it is a step to the issue now. There are so many crises in Ypsilanti. There is an encampment at Bell Kramer, big people have been talking about. There are encampments all over the place. There, are people falling into mental health crisis because of the compounding factors of being homeless and having substance use issues and mental health issues. And this is not something that is like maybe on your front door or front step, but it is on ours, and we need help now.
I just want to quickly add to that housing or care delayed is housing or care denied. And as I was saying earlier, if we believe that housing and shelter are a human right, and there are 850 people in our community that do not have housing and shelter, that means we are literally violating the human rights of 850 people in our community right now. And that means we need to act with swiftness and decisiveness. And it's going to mean that we're going to have to spend money, but we always can find money to spend on all kinds of other things, like tax breaks for developers. But we can never find money to spend, even if it's just a few $1 million, to actually house people that need it the most.
Yeah, go ahead.
So all of that is great, but what I want to talk about and what I want to add is that it's not just about having a single shelter. It's about the integrated services that come with that. It's about job placements, and that means more than just like a minimum wage job at Subway. It's about long-term housing solutions. So they need a place to go from a shelter to a permanently affordable unit. I've worked with a lot of people trying to get housing in like an independent manner because there isn't anything locally. And these people need more than just a place to stay for a few nights or a week. It's a whole life. It's rebuilding a whole life for a person. And we need to take that into consideration when we're building out a program like this.
Yeah. Well, we're going to keep you to 1 minute instead of 2.
Absolutely.
Enforce.
I'll try to make that minute work. The county has stepped into the breach in a way no other form of government has here locally. Commissioner Somerville is supportive of a shelter. We are in the process of trying to get federal funds through the earmark process to purchase one and have it operationalized. The county is also the entity that is in charge of response to the continuum of care cuts and was the entity that fronted nearly $487,000 this spring to ensure that we had a backstop for if those cuts hit. So I welcome any and all partners in that effort. I think we need a big table, and I look forward to doing more work with my colleagues at the board and in the community.
All right. Thank you, community. Thank you, candidates. This wraps up our local and county government segments. So we're going to do a room switch right now. We're going to have the state candidates come up. I encourage you to stretch your legs. Also, for the record, if y'all need to stand up, move around, if you're like a kinetic processor, please feel free to move around this space. You don't have to stick to your seats if that's not how your brain works.
Thank you.
And people watching online?
Yes. I'm for like sticking to time. Oh, sorry. She ended up. Was that anything to say? Literally, it was just bad. But the face also. Let's just leave it with this. But let's like, I just moved it. But maybe that was like. I guess if it didn't have sound, that's probably why it doesn't. Oh, yeah, good for me. You, how? I don't know what to do. Here, let me pop up the phone so that we don't have to undo yours. Like that can just stay. All right, folks, and we're gonna get started again in about 4 minutes at 6:35. 6:35, we're gonna get started. Know what right there? Yeah, that's a good call. Let me. Oh my god, it's like. Like, so go. So it's good. I can be You have plenty of those. Oh, so I just CPJ VOTE Caucus. But you wanna just you wanna talk to her and like announce it back? Being to Jennifer. So this yeah, yeah, yeah. Like yeah, I am so getting a cup of yes. It's as a I just yes. Let's have a burger. Yes. Yeah, really. And so the polls what happened before the exam fair. Let's see if it's right. Like, someone can just try and let me know. Yeah. Hello. Example. All right, folks, just a couple more minutes here. We're gonna get started. Luis, I'm gonna podcast that. I was trying to figure out what it is. Well, that's the eight up. Oh, you know, sometimes my I'm saying, oh no. To say that it's good for that. Yeah, it's a one. So, do you guys know this stuff on another good? So, all right, folks, if we can take our seats, we're going to go ahead and get started. Okay, so thank you so much. Welcome back. Again, my name is Jennifer Harrold. I'm with the ICPJ VOTE Caucus. We are now moving into the second half of our candidate healthcare forum. And this is with our state candidate discussion. So we are going to move in much of the same format. We will have questions that are going to be elevated to these candidates on vaccination and public health, immigration and healthcare, budgets and priorities and state leadership. That every candidate will answer every question. However, every candidate will have the opportunity to respond to every question in writing. We'll do about 30 minutes of moderated discussion on these subjects, and then we will elevate questions both from the chat from the community members who are here for about 20 minutes or so of Q&A. And then we're just going to wrap up with some other ways for you to get involved on the state, local, and federal level in issues of healthcare equity and justice. So thank you to all of our state candidates. We're going to go ahead and ask you to introduce yourselves with your name, the office that you are running for, and in one sentence, why you are seeking office. And can you use the mics? Thank you. It's okay. Is this working? Okay. Hi, I'm Sue Shink. I represent the 14th State Senate District, which kind of goes from like northeast Washtenaw, zigzagging down through southwest Washtenaw, and then about 3/4 of Jackson County. And I am running because I want to live in a community that is, okay, sorry. I thought about this a lot and then I need to start over. I love serving our community. I love working with people and trying to make things better. Hi, I'm Morgan Foreman. I am running for state representative in Michigan's 33rd House District, where I've currently served for the past 2 years. I'm running again to continue a lot of the work that we've been doing. Unfortunately, we've been in a Republican majority in the House, and I want to get to a Democratic majority so that we can get some work done.
I am Jennifer Conlin, and I'm running for re-election for state representative in House District 48. It's an interesting district that runs from Ann Arbor, very progressive, all the way up to Harrold, Michigan, very conservative. And I'm running because I care a lot about families. I'm a caregiver. My 92-year-old mother lives with me. I have a daughter about to move back in. My brother lives with me. I know a lot about affordability problems for people. And I'm running because I care a lot about paid family leave, education, healthcare, and the astronomical costs of everything right now.
Thank you for having us, ICPJ. I'm State Representative Carrie Rheingans, and I'm running for re-election to my 3rd term in the Michigan House of Representatives, representing the 47th District, which is Western City of Ann Arbor, Western Washtenaw, and Southeast Jackson County. I am running to reduce costs, increase care, and fight corruption. All right, thank you so much. Carrie, you can hold on to that mic because we're going to give this first question in first quarter to you. This is around vaccination and public health. It's a little bit of a meaty question, so I'm going to go slow and make sure that everyone online and in the audience who doesn't have a beeper is able to hear the question. Vaccination rates have been declining in recent years, and Washtenaw County recently experienced a measles outbreak. You have some folks who believe that rebuilding trust through things like education and outreach should be the primary response. You have other folks who believe that Michigan should also reconsider policies such as philosophical or religious exemptions, as some other states have done. The question for you candidates is, how do you think Michigan should approach this issue? And what principles guide your thinking? And we're going to start with Carrie.
Thank you so much. I'm one of only 2 legislators in the Michigan legislature with a Master of Public Health, so I love public health and think of everything that we do through public health and health policy lines. I think the issue of vaccination is the tension between American fundamental value of individualism and having freedom for you to do what you want with yourself and your life, and the value of collectivism, which means the collective work that we all do together in a society where we all live and impact one another. I tend to land more in a collective thinking mindset, despite being raised American and having many individualistic thoughts. But I think when it comes to health, we are not individuals that don't interact with other people. We are all breathing the same air right now as we speak, and there could be viruses floating in this air. And therefore, my exhale does impact your inhale. And so I think that it is the role of government to interact and make sure that we're keeping our whole entire community safe whenever possible. So we do allow for religious and philosophical exemptions to vaccinations in Michigan. I think we should slightly reduce those. There are some the tension with religious freedom is another tension that interferes with public health sometimes, as well as work on building trust. So I don't think this is an either or the way the question was posed. I think we need to do both, build trust, do more education, and help people choose to make the choice to care about others
in a very concerted way. And I think that the role of government is here in part to support that.
Thank you so much. If we can pass the mic down to Sue.
So to answer the same question, I think again, my answer would be both. There is a concerted effort on the part of the Trump administration to destroy our trust in public health, and that's difficult to fight. One of the things that I've been trying to work on in my role is how do we fight propaganda? And I don't have a magic a good answer for that at this point, but it's something that I'm working on. I think it's important to remember that making people do things that they don't want to do often doesn't work. And building trust is a way to get people to buy in and make sure that the decision to do the right thing is their decision. And I think that democracies work best when the most people affected are involved. And so I think that the role of public health and bringing diverse people to the table to make sure that they are part of the conversation, as well as having people within the community reach out, the trusted advisors, is really important to building trust. And maybe it's because of my experience at the county. Maybe it's just because I don't like being told what to do. And I did raise my children in a time where we didn't know why so many kids were developing autism or born with autism, and there wasn't information disproving vaccines. I think it's important to make sure that we use good scientific information, build trust, have diverse people at the table, and then build that trust from there, because that is the best way to get it done. Thanks.
Thank you. And I know these are juicy questions, and so we're not going to have every candidate answer every question. So we're going to keep it. You will have the opportunity to respond in writing.
Okay, I understand that, but I did a bill package on the vaccine, so I'll put it in writing, but there is real tangible work going on in the Michigan House too on the vaccines.
Perfection. And we'll come back to it. We have some time to circle back, and maybe you could talk about that. But we're going to move on to the second question. Morgan, hold on to the mic. For state, this question is around state leadership. While Michigan doesn't control every part of our healthcare system, it does make decisions that affect whether or not people can access care. What do you believe is the state's most important responsibility when it comes to healthcare? Morgan, we're going to start with you.
I believe the state's most important responsibility to healthcare is access. This week, we're probably going to take up a very dangerous package of what Speaker Hall is calling hospital accountability, taxing hospitals, just a very horrible package, taking like the reimbursement rate and making it like 200% of Medicare, which is actually very low. So I believe it's allowing access and making sure that everybody that is on the soil in the state of Michigan has access to quality healthcare, and that has access to emergency rooms and spaces and labor and delivery and senior healthcare. I am my grandmother's caregiver, and she's in hospice right now in a facility. And as a family, we're trying to figure out, was this the best decision? It seems that from our last experience with hospice to this experience, a lot of it has changed. And I think a lot of that has to do with the Trump administration taking so much out of healthcare that they've moved to just comfort care only. And they've just gutted the trust in the health system. So I believe it's access. It's getting people there. We talked about that on the last panel. It's getting people there. It's getting it to people. It's bringing it to people's homes, bringing the nurses in, bringing the doctors in, the community ambulance services, all of that. So I think that it's just access, and that the state needs to invest more money in that space. I don't think that we're investing enough.
Thank you so much. Jennifer.
Thank you. Yeah, for me, I worry so much. I literally stay up at night worrying about these Medicaid cuts. And part of it, these federal cuts are going to require that people do their work requirement documentation every 6 months in order to continue on Medicaid. And we literally do not even have the people of the state government to do that or the system in place, because we got rid of that years ago when we saw these as barriers to access to healthcare. And the governor has built into her budget a lot of money for some full-time employees to do this. The Republican budget does not have that same amount in it. But beyond that, in my district, which is very rural parts of it, I have farmers who have no idea who's going to say they were on that tractor 5 hours a day. Nobody's watching them. They don't have broadband out in some of these places to even do the paperwork. So my concern is around that, as well as the senior tsunami coming our way, which I'm probably going to be a part of. And my mother is aging in place at our home, but Rep. Foreman and I work a lot together and want to do a lot more around direct care workers. She's dealing with hospice care right now. That's disappointing the family. I was up twice with my mother, who fell down in the middle of the night last night at 2 a.m. and 4 a.m. So there's a lot of help needed for people doing it either way. So that's what we need to be thinking about.
Thank you so much. So this next question is around, oh, no. Who answered this question? I am so sorry. Okay, perfect. Yes, we are going to have the next question. We're going to talk about immigration and healthcare. So some members of our immigrant communities delay or avoid seeking healthcare because they fear the consequences of interacting with public systems. What responsibility, if any, does the state government have to address that? We can go ahead and start with Carrie, and we're going to ask all four candidates to answer this question.
Thank you. So state government can help by protecting providers in these settings from sharing information with federal agencies that may seek this information to do harm to individuals, especially immigrants. We can shield those providers. We can shield those institutions. We can shield that data. We can pass state laws to do that. We can also require judicial warrants for any immigration officer going into any healthcare or healthcare adjacent setting. We can also ensure, one thing that I've been working on for the last couple of weeks now is that in Michigan, obviously, I think folks here are very well aware, immigration infractions are civil infractions, not criminal. And so the individuals making civil infractions do not need to go through criminal processes or be treated in a way that somebody with a potential violent conviction or something might be treated for the safety of hospital staff. Hospitals in healthcare settings don't have protocols for interacting with people accused of civil infractions. So a lot of our hospitals in Michigan are actually treating detainees or people that have been kidnapped and taken to the concentration camp here in Michigan that need to get health care. Those hospitals are treating them like criminals because they don't have any other protocols. So we can, as state lawmakers, require that they develop a civil procedure to treat humans like humans if they possibly can. So we can also pass state laws to require accountability for any federal agents that violate state laws or state civil rights infractions. And I've introduced a lot of bills to do that, but they're going nowhere because of our little mini Trump, who's the Speaker of the House in Michigan right now, who has decided to kill all of those bills. So we need regime change in Lansing in order for that to happen.
Thank you, Carrie. Jennifer.
Yeah, thank you. This is such a big issue, particularly now, because every single immigrant who was in the process of trying to become legal in our own country is no longer able to follow that process. Every process is gone, basically. So every one of them now is terrified. Whether you're here as a federal asylum seeker with the federal program, that's gone. Everything is gone. I even was with a friend who is a green card holder for many years last night, who is worrying about coming in and out of the country just because she doesn't know what could happen to her. So in part of my district, again, in a very rural part, obviously we have a lot of seasonal workers on these farms, and they have built up real relationships with the people who work for them. who they work for, I should say. You know, they come in on that seasonal, is it the H-2A visa? They come in on the H-2A visa, and normally that would have been something where they could get healthcare if they needed, if they had an accident while working, and they don't want to go in, and they're terrified to do so. I do have in Pinckney a federally qualified healthcare center that anybody can come in. They don't ask one question, and they treat you. I was able to get them, you know, a measly $5,000 grant that meant so much to them. And I felt badly that it should have been 9 times that for the amount of people they treat who are coming in with no health care.
Thank you, Jennifer. Morgan's.
I'm just going to echo the sentiments of my colleagues, especially Representative Rheingans, because this is something that she has continuously worked on. As she said, she's drafted tons and tons and tons of bills and tried to work with the other side of the aisle as well. There's just, of course, no appetite for it. And in August, it's the government operations, which this speaker uses government operations committee. Unlike other speakers, he uses that committee to either kill things or put things there for when he wants to break them up to make them divisive and just trap us in the chambers all day with the air conditioning on blast, saying that he wears heavy suits and that's why it needs to be cold in there, which is their polyester from Men's Warehouse. But to answer the question, I think that the state actually, I think states in general have to take a bigger role because our federal government is failing us. And so a lot of times we look at immigration and stuff as like federal issues, but obviously we don't have a federal government that cares about people and their humanity. And sitting in a border state as well, where people could be, you know, people always talk about we go to Canada to get better health care. Well, my Canadian family comes over here to get health care. They come to Ann Arbor to get their chemo. And so they're also afraid of doing that right now. So the state has to really, we have to really start looking at the laws that we make and the policies, and protecting people, making sure that Washtenaw County, I don't worry about our law enforcement, but I worry about other law enforcement in other parts of the state and what they might do to people. So we have to let people know that we are safe and that they can access us and their legislators, and that we'll do the best that we can do to protect them going through that process, because again, healthcare is a human right.
Thank you. I echo what my colleagues said, and I appreciate being able to work with them and my other Washtenaw County colleagues because they all really care about people. So Jennifer, Conlin, and I were able to get a state grant to develop a healthcare center in Whitmore Lake that takes, as all federally qualified healthcare centers do, community health centers. They take people regardless of citizenship, regardless of ability to pay, regardless of insurance status. So if you're talking to someone who is an immigrant and is worried about ramifications of seeking care, those are places that are safe. They can look it up online to determine, to double check that. So we do have some bills in the Senate. I think they're passed out to ensure the safety and dignity of all residents by making it illegal for immigration enforcement to go to sensitive places. And that would include healthcare, and then also protect the privacy of personal information by prohibiting governmental entities from giving personal identifying information to others for the purposes of immigration enforcement without a judicial warrant. And that's really important because if people are afraid that if they go to the doctor or a whole bunch of other places that they need to go to, because immigration enforcement may come and kidnap them, then that's a problem and they aren't going to be seeking health care. I think to speak about my general philosophy, when people are on Michigan soil, we should make sure that they are cared for, regardless of where they're from or how long that they're staying. And if they need health care, we should make sure that they have access to it. Thank you so much. And so this last question is around priorities. And again, we're going to ask every candidate to answer it. So if y'all just want to run it back in the opposite direction. There's the saying that says a budget is a moral document. And every budget reflects a set of priorities. Now, given the fact that we understand that y'all cannot take on every single thing at every once, you're only limited, your office only has so much power, you only have so much time. The question is, knowing that every policy benefits some communities more than others, when you think about healthcare policy in Michigan and budgets, we're not going to all these things. Who's this feel most urgent to you right now and why? We're going to start with Sue. So I think that the people who I see going without care are the people who earn the least amount of money, who have mobility issues, and often people of color. And I represent Jackson, where I have met many people who live in an area that was robbed during urban renewal by white people, forcing people out of their homes so that they could buy them at a much reduced price. And the people who live in that space, who are mostly Black, have a harder time getting health care. They have a harder time getting good food. They have a harder time getting good jobs. And they're just as smart and just as amazing as everybody else. It's just racism. So that's been going on for many, many years. And in Jackson, Black women are 40% more likely to have a serious complication. And I've met a lot of people who lost their babies, and it's just so wrong. So that's my priority as we're going through this. And in so many ways, if Michigan doesn't make those areas, those people our priority in a whole host of areas, we're going to continue to struggle as a not thriving state. In so many ways, we are amazing, but we have some serious, serious gaps, and we need to fill those gaps. And a lot of it's with money. So thank you. Thank you. Morgan.
Normally, as a health policy researcher and somebody on the health policy committee, and all the testimonies and stuff I've sat through, even in my lived experiences as a Black woman of maternal age, I would normally say Black women. But I do believe that there is a lot of focus on Black women's maternal health right now. And so I could take the spotlight off that and put it on senior citizens. When I walk in the facility that my grandmother is housed in right now, I am appalled in a lot of ways with some of the things that I see, and how this facility is getting rich off of Medicare and Medicaid dollars because people are living there, and there is a derelict of duty and staffing issues consistently there. It's so bad that I have to schedule people to help my grandmother eat on my own, right? I have to have friends and family go to help her eat. And so right now, I think we have to really focus on seniors and the aging population. And those people also, some of these seniors have had disabilities their whole life, and they don't have anywhere else to live. So they're living in a nursing home, and now they're not being cared for properly. So that is where I think that the state needs to begin to put some focus so that people can age in place with dignity. I have seen some of the most undignified things in this space, and it's hurting my heart. And not everybody has a granddaughter or family to go and advocate for them and make sure that they're taken care of properly. And something has to be done about it, or we're going to be losing people to senseless infections and things like that when they weren't ready to die.
Yeah. Thank you. Jennifer.
Yeah, well, obviously, along the lines of what I talked about, the people who are on Medicaid, and I'm very concerned about what this big, horrible bill will do with these work requirements. Also, seniors, which touches me personally as well, but I think I really am worried as well, just generally about the family, because I live in such a multi-generational home, and we don't have, paid family leave. So when you do have a child who's sick, or a mother who's sick, or a sibling, or whoever, we don't have any way for you to go and care for that person. That's something we wanted to get done so that you would still, earn your income while you are taking care of your family member. And I'm hoping we can get done if we're so fortunate to get back to majority. But also, I worry so much about the children out there, because I've been sitting on a child welfare committee, and I know exactly how many problems we're having with younger people, mental health, their parents' mental health. You don't have enough residential facilities for kids with enormous behavioral problems. Their parents love them, but they can't have them at home. And so I've seen a horrible system around that really has to be addressed. So And then we have the Republicans trying to take away free school lunch, school, breakfast and lunch. I mean, this is food for kids so they can learn. So I'm kind of worried about that whole health space for the family.
Thank you so much, Karen. Thank you. So, one thing I will say in the United States of America, the way we pay for healthcare drives how that healthcare is delivered. I reject the way that we pay for our healthcare right now with for-profit corporations and skimming off the middleman like 1,001 times so that the patient who pays for healthcare barely gets any healthcare in the end. That's why I introduced House Bill 4407 to establish MyCare, which will be a Michigan state level single payer payment system, which would ensure that everybody has coverage, has payment for their healthcare, regardless of ability to pay, with no co-pays, no deductibles, no monthly premiums. So I worry about people who can't afford healthcare, which right now is more than half of the people of the United States of America, according to a Gallup study that came out this week. I'm also worried in general about the disproportionate lack of access of healthcare for Black, Indigenous, and people of color in Michigan. I also heard a question earlier about how do you incorporate voices of people who maybe not are always engaged. And I think we need to systematically incorporate those voices, which is why I introduced a bill to establish the first in the nation Office of Legislative Tribal Liaison. Our state legislature is the only legislature in the country that has an office whose job it is to have Indigenous voices help drive policy making while we're drafting the bills, not just as we're implementing it in the administrative branch of the government. That bill was helped. I got help writing that bill with my staffer, Ryan Bartholomew, who is also running for Ann Arbor City Council. He couldn't be here tonight due to another engagement, but that kind of building into the system the voices of people who need to be heard. I think that we need to be doing more of that in general. And I think that federally qualified health centers with half their boards being required to be patients who go there, I think more healthcare services need to be built like that. The MyCare board in our bill requires people with patient experience to be board members. So that's, I believe in building those voices in systematically so that we can't ignore them.
Okay, thank you so much. So folks, that is our moderated discussion. If you have questions, we're going to move into our Q&A. I got some. If you have a question and you have it written down in a card, can you just raise it up? If you need a card to write a question down, can you raise your hand? And then Des will make sure that it gets to you. Okay. So this first question reads, there was a recent executive order rescinding the right of disabled people to receive care at home and return the right of states to institutionalize these individuals. What can Michigan do regarding this possibility? Whose question was this? Do you have a... it's open.
This is a federal executive order trying to stop federal dollars from being spent in our state for home-based care for people with disabilities. And our state could try to backfill that along with backfilling all the other shit in the big bullshit bill that got ripped away. Our state budget doesn't have enough money for that. So I think there is limited things that we could do. However, I don't think this is going to fully go entirely into effect and immediately rescind all those federal dollars. I think with enough public outcry, we have seen the Trump administration backtrack on a ton of things. So I think we need to have a lot of public outcry about this. You may remember part of the reason we even got the Americans with Disabilities Act is because of the very public direct action that people with disabilities did in Washington, D.C., literally crawling up the stairs of the Capitol building. And so the power of the people is definitely something that we need to leverage here. And I wouldn't say all hope is lost personally. So don't give up. Other comments?
This is adjacent. So the federal government said we're going to take away SNAP and Medicaid and you have to do what we say or else. Part of the reason that the budget took so long to negotiate or didn't get negotiated until last October, when it was supposed to be done at the end of June, was fighting about that, among other things, including Barb's kids. But I think that Michigan is committed to trying to, I don't know, for shorthand, not be an asshole to its people. And so, or said Democrats are. And so I anticipate that we will do everything we can. I know that the Senate Democratic Caucus will do everything we can to protect people from that the way we were able to deal with standard Medicaid, which doesn't mean we're not going to be hurt, and actually Medicaid enrollments are down, is that we were able to decouple from the federal taxation and do it a different way so that we had more money to backfill the feds. But that only lasts so long. So it's just something we're going to have to keep working through. And also our attorney general works really, and her staff work really, really hard to fight all of these terrible things and have kept us a lot safer than we otherwise would have been.
Does anyone else want to answer this question? Okay. This next question says, are there particular parts of care, be it doctors, hospitals, ambulances, hospices, nursing homes, etc., that you view as operating for owner or stakeholder benefit rather than for patient or resident well-being?
The entire American health system. And I'm not trying to be sarcastic. Actually, our health policy chair gave us a book about healthcare and how it became big business in America. I'll look that up here in a second if you want to read it, and I'll give you the name of that book. But I remember, okay, so funny story. I was in college and I choked on a lifesaver. Now you're probably asking, Morgan, how do you choke on a lifesaver? Because it has a hole in it that is designed for you not to choke. If it can be done, I'm going to do it. Okay. If it's a freak accident, I'm going to have it. So I choked on a lifesaver. They had to have an ambulance come and get me. I got a bill for $800 from Huron Valley Ambulance about me choking and almost dying, and then having to take me from Washtenaw Community College to the emergency room, which honestly, somebody could have threw me in the back of their car and drove me to the emergency room and we would have got there quicker. But that was ridiculous. And I never paid them. And it's still on my credit report and I do not care. We'll be talking about medical debt this week at the Michigan Hospital Procedures. We'll be talking about medical debt this week, but I think all of it is, and I think it's because of American greed and consumerism. We have lost the plot. We have just lost the plot as a country. I don't necessarily agree with what the founding fathers said and how they said it, but I believe in the words that they said, that we, the people, the right to life, liberty, and the pursuit of happiness. I believe that. I believe the Constitution, but we have just lost the plot with it because we have all, not the people in this room, but the powers that be and all that have lost their cotton-picking minds. And so we just, the whole thing, like what I'm witnessing right now at this facility my grandmother is in, it's insane. It is insane. So yes, the whole thing, the whole shebang.
Yeah, I would just add to that. I lived in the United Kingdom for 12 years. I had a baby over there in the National Health System. I had, all these children who could get doctor's appointments for everything. You never had to even think twice about going to a doctor because it just was paid for. And basically that included the pharmacies. My daughter burned her hand and the pharmacy took care of it. I'm coming every single day and we'll pay the done for you. And we're doing that. And one of the things we did do around vaccines was allow kids over 3 can get vaccines at pharmacies because that does give more access. So you don't have to get to a doctor's appointment and do this. This is a very simple thing. But also I have 2 bills. One is to cap insulin at $35 a month because it's done on a federal level for over 65 if you're on Medicaid. But this would be in Michigan for those people. We have a lot of, like 1 out of 10 Michiganders has diabetes and they are rationing their insulin. And that leads to so many bad health outcomes that puts more strain on our medical system. I also have something for inhalers because we have a lot of people with asthma to cap the cost of inhalers every month at I think $25. So we're just trying to do something because of the problem with these costs of these pharmaceutical drugs, which by the way didn't cost anywhere near this when I lived in England.
Thank you. Anyone else?
Okay. We're going to circle back a little bit to the question that we had about immigration. There's some really good things were being said about like the policies that should be in place and protections that do exist. But given the absolute trauma that folks have experienced trying to access the healthcare system, not only just as you might be immigrant or undocumented, but you're disabled, you're Black and your baby died, these things. There's a lot of policies that can be put in place. But the question for y'all is, how do you then heal a community or get your constituents to back into the healthcare system, able to trust that I don't want to be the person that steps out here and tries to pressure test it and I find out that y'all were wrong. So what does it look like for these policies to be, how do you rebuild the trust that we can access these policies when folks are afraid you don't want to deal with it?
I think that comes down to partnership. Actually, I think that as legislators and as somebody who interfaces with the medical community a lot because of my committee, I think that comes with, hey, I need to talk to the people who work in the hospitals, and this is what is happening, and this is how people feel, and there should be training. They're consistently trying to take away medical bias training from our medical schools, which I think we need a whole lot more, and have discussed a package on training from CNAs all the way to the top neurosurgeons on medical bias training continuously, and a more extensive course in medical school. However, I think that is where like we as legislators need to partner with the community and partner with our hospitals and work some type of and I guess this goes to the restorative justice stuff I'm working on. Work on restoring that. It's going to take real restorative work, and it's going to take it in places that are not clinical. It's going to have, there will be tough conversations, there will be brave conversations, but it's going to have to happen in places that there's not a clinical setting that feels safe. And that's going to be something that we're going to have to lead, and our healthcare leaders in this county, U of M, Trinity, whoever else, Corwell, as well, Henry Ford, are going to have to sit down at the table and hear and listen and do.
Thank you so much. Anyone else? I agree very much with what my colleague said and appreciate her leadership on this and all of you. One of the things I've been able to do, and I think a number of my colleagues also do this, is have senior summits. So this isn't a total solution, but we bring a lot of providers of services for seniors to a senior center and invite seniors. And one of the things that we've noticed is that people who haven't had their blood pressure taken for a really long time sit down and have taken. It's all free. They get the information, and they can not necessarily be referred directly to a doctor, but to a health center. And throughout my district, there are a couple of federally qualified health centers who take people regardless of ability to pay. I think what I see is those trusted community advisors, which are people from the community who are working as liaisons between the health center and the neighborhood, are an important piece of this as well, because they're trusted and they have the back. So there are a number of ways to work at this. And I think that one of the most important things is when people do seek healthcare, that they're treated with respect, which isn't always the case. And so I appreciate a lot what my colleague just said. Thank you. I think one thing that we can do is, one of the things I'm excited about my care is that as a bucket of money, it can be used to pay for necessary medical expenses for Michiganders, but also it can be used to help pay for degrees or training programs for people who might want to work in the healthcare space. And I think our healthcare delivery system needs to look more like our population that we're serving. It needs to speak the languages of the people that we're serving. And so I think it's not just like anti-bias training. It's like get actual people from the community to work in there and help pay for that to happen. Put your money where your mouth is. I also think that the profession of community health workers is something that's very important and needs to be better financially supported. And this is a way to help build trust in communities and with community members, and help use the lived experience and inherent knowledge of people who've grown up in various communities across the state to help inform and drive the healthcare system from the ground up and help make sure that we can rebuild that trust. And I think that we need to pay them and pay them adequately. So those are some additional things I think you should do to build trust. Thank you. Now we're cooking with gas. We are also like really good on time, so we are going to get through everyone's questions. So if you're like a little antsy, like, oh, I asked my question yet, we will get to all the questions that have been submitted. I want to take it back. So this is listed by the ICPJ VOTE Caucus. And so obviously we care about voting. And we've been talking a lot about healthcare issues, some healthcare policy, some of the things that y'all have advocated for, the committees that you're on, the legislation that you're working for. But I think something that we all know is that there can be a lot of disenchantment and a lot of disconnection between what I feel like I need and my desire to vote to get it. So in a way, let's just take the creative leap of saying, I am a first-time voter. I'm 18 years old. I care a lot about healthcare. I do not know how voting affects my healthcare. What do you say to that first-time voter? So as a first-time voter, you should know that your vote will decide the people who are going to be making the decisions of an $80 billion state budget. The biggest department that will be funded in our state's budget is the Department of Health and Human Services, which affects how easy you can apply for and receive SNAP, your Medicaid, regulate, and then outside of that, how we regulate hospitals and health systems and clinics in Michigan, and how we make sure that they have anti-bias training, and how they make sure that they are open during a certain number of hours. So your vote determines the people who make those decisions, and you need them to hear you through your vote and other ways to engage, because voting is only one of many ways. So for a first-time voter, I need you to understand that that is how your vote will affect this. And you need to also understand, in a representative democracy where majority rules, if you end up needing things and you elect people that are in a minority, there's a limit to how much they can do. Now, we can be rebel rousers, and some of us take that job very seriously to heart, like I do. And, some people run away when they see me coming, like Blue Cross. They canceled meetings with me last week. So, but like, yeah, there's kids. So, there's more than just voting. You need to keep the pressure on if you possibly can, and make your voice heard, be it in social media, coffee hour, or just follow somebody around the grocery store.
Well, as I like to say, is also that you're not allowed to complain about the state of the country, and the state of your city, and the state of your state if you don't vote, because basically that's where it comes down to. I didn't even enter politics until I was 60 years old, 4 years ago. I was a journalist, and now that I'm actually in this position that I kind of can't believe, where I can hit a button and actually vote to get red flag laws, or to get, universal background checks, or to get vaccines in pharmacies for kids, or school lunch. I'm amazed by, the power we have that the electorate puts into our hands when they vote for us. And it's really important who you vote for. And I have obviously a swing district, so I have half Republicans in my district. But I know they know I listen to them. And even if we disagree, they know that I'm willing to hear what their thoughts are, that they're not always all wrong, because there's a lot of moderate Republicans, there's a lot of independents out there. And so voting is so important.
As the only Black woman sitting up here right now, I'm going to say something about a trip I take every year. And I asked Rep. Rheingans, and I asked everybody to come with me this year, but Rep. Rheingans came with me. I go to Selma every year. You are sick. It's fine. So it's okay. You weren't allowed to go. You had to do work. But I go to Selma every year. It's very much an important pilgrimage to me, as my family marks that same bridge and the same places that I'm standing now. I wrote an article about a month ago. It's in the Michigan Chronicle called Jim Crow is Coming to Dinner, and We're on the Menu of Black Voting Rights, and the erosion of voting rights that's happening across this country. I am watching it happen. My family is going to be affected. My family in West Tennessee will be affected by those new maps that they just drew. In Michigan, we have somewhat avoided that a little bit because of our independent citizens redistricting commission. And so I am a 10 toes down voter. My grandfather took me to vote with him when I was 2 years old. But I'm going to say this, if you're a first time voter and like, let's say somebody comes and knocks on your door, listen to the candidate that's coming. It's not easy to get up there and knock on people's doors and walk around neighborhoods and get chased out by police and stuff. That is not any fun. But listen to the people, do the research, and like, you know, the electorate puts a lot of trust in us. And if you feel like we're not doing something that you need us to be doing or talking about what you need to be talking about, talk to us about it. And we're happy to listen. Come to our coffee hours, stay engaged, but get out and vote. One vote. We know this in the state of Michigan. I sit with people in the chamber who won their election by 4 votes, 58 votes. One vote could change the entire trajectory of things. And it's very important that you elect the people that you want to go be your voice, because there are some districts in this state that have people who are not the voice of them. They are the voice of themselves and their special interests. Luckily, that's not you in Washtenaw County with anybody, but that's how it is.
So I represent a district that is considered marginal. When they first drew that district, it wasn't really clear whether a Republican or a Democrat would win that. I'm trying to make it a safe seat, so I'm on my way. But if I hadn't won and we had the House looking the way it does now, it is very likely that Medicaid and SNAP would have been severely reduced. I mean, we walk around saying we save Medicaid and SNAP from Michigan. What does that mean? That means that fewer rural hospitals will close. It means that fewer urban hospitals will close. It means that more medical services will be available at more hospitals. It means that doctors' offices will not be going out of business because they serve Medicaid patients and non-Medicaid patients. It means we have healthcare. SNAP, same things. It means that children across Michigan, like almost half of Michigan, get some form of food assistance. And that means that they'll eat. But it also means that our grocery stores will stay in business because they sell food to people with SNAP. And without SNAP, they would go out of business in rural and in urban areas and suburban areas too. And the farmers, they would not sell as much food because people would be going hungry. We are all connected. And it makes such a difference. One seat in the Senate is the difference between having and not having.
All right, folks. So I'm going to lean on the fact that y'all have relationships with each other and you can kind of decide amongst yourselves who's going to answer these next couple questions, because we do want to make sure that we get you out of here and we get folks out of here to their other obligations and to their families and things. So this question says, the Dems had a chance to end prison gerrymandering. How do you work on this matter in the minority, or if you were to get back into the majority?
Back into the majority, we just ended.
I think they voted out of the Senate. I can only take responsibility for the Senate.
Y'all had a weak majority the last time. Oh, I can't say that. I was staff, so I can say that I was staff the last time. Yeah, weak majority. I don't know.
Morgan said, do not at her, do not email her about how this happened.
Guys, also, do not follow me around the grocery store. Here he said follow. Do not. Don't do not do that. We do have some, and even though we're elected, we do deserve some type of privacy. Don't be questioning my cheese choices.
And there's so much we did not get done. You cannot believe how long I was just made a whiteboard up in our caucus room of everything we're going to try to do. So it's just taught us a lot being in the minority, because Carrie and I came in the majority, so did Sue, and it's pretty dismal staying in the minority.
All right, folks, we got 2 more questions. This one says, I've heard about federal things. Can you speak to any of these state legislature options? Read the options that they listed. This says Medicaid reimbursement, prescription affordability, medical debt protection legislation, and I think this is community health workers. Community health workers reimbursement. Okay, Medicaid reimbursement and CHW reimbursement. Right now in Michigan, we do pay in a little bit for CHWs by paying contracts to managed care contracted, mostly private insurance companies, and then they can pay an organization to employ a CHW. So it's not a fee for service model. Medicaid reimbursement,
as a separate topic is also just woefully inadequate here in Michigan and in most of the states. So we need to actually have our actuaries do a better job in increasing that rate, but they are, we don't get very much money from the feds in order to match that and then pay a lot. So Medicaid is the worst payer of all payers in Michigan, which is why so many providers don't take it. So do you want to talk about prescription drugs and Morgan about debt? So tomorrow, on our agenda is House Bill 5254 by Rheingans, adds violating the Medical Debt Protection Act to the list of unfair, unconscionable, and deceptive methods under the Michigan Consumer Protection Act. House Bill 5255, Representative Pohutsky, creates the Medical Debt Protection Act to limit the interest and charges on medical debt and limit the actions that can be taken against patients regarding the collection of medical debt. You can Google these and look them up on our session website, our legislative website, and you can see exactly what the bills do. But tomorrow that is up for through passage. So if the House passes these bills, then we will start to, and the governor, this has been one of her main priorities. I sat at her table in her house and we had this discussion. And so this is a main priority for a lot of us. Senator Anthony, our appropriations chair, Luke Meerman, a Republican. This is something that affects everyone. Medical debt and school debt is crippling people's ability to own homes, have cars, buy something and a phone on Klarna. It is just really messing with people's livelihoods. So it's important to take up. So I'm very happy I'm going to be voting on that tomorrow. It does look like we're actually doing something at the Michigan Waffle House of Representatives.
All right, thanks so much. So this last question, it's perfect. Oh, go ahead. There's legislation that in the Senate, and I have one of the bills to have a prescription drug affordability board, which would seek out and place price ceilings on medications that are being basically where the drug companies are gouging people. And so it's a great idea to actually put a ceiling on some of these medications that people really use a lot of, and that drug companies think that, oh, well, we just gouge because we can. And just whoever did that card, that was a lot of really big questions. All right, so this last question, and then we're going to do our closeout. It's great because this is a yes or no question. So Gail Summerhill, can you stand, please? This is Gail. Gail's question was, did you know that Gail Summerhill is on the Dana Nessel Elder Abuse Task Force? Awesome.
No, not that I was on it. I was the only person chosen by her in the state to be on the task force.
Thank you. Here is Gail. If you would like to talk to her about that after, she is here.
So you are commenter as far as my authority to go into any facilities. I will, when you don't know, I can explain it to even more than what she's saying.
All right, folks. Well, thank you.
Okay.
And that is our forum today. So I want to go ahead and thank all the candidates for participating. I want to thank the community members, our tech staff. Thank you, Emily, does, everyone who helped to organize. We do have just a little bit of information to close out. So we'll send this out, but if you go to bit.ly ICPJ Healthcare, we have some more information there about, there's a presentation with vetted methods to address healthcare at the local, county, and federal levels. We encourage you all to vote. And I do want to say one thing with closing. So if you notice when folks came through here, we were calling them Yousef or Morgan or Jennifer or Carrie. This is not to take respect off of their names. This is not to say, we understand. And if I met you in a different circumstance, I would absolutely Representative Freeman. But one thing that it's really important for I apologize. One thing that it's really important for us to always remember is that these folks are people who we elected. If I'm Jennifer, you are Carrie. And that we intentionally try to reduce that distancing in these spaces because these people are not superhuman. They got two heads. They are not smarter, brighter, more worthy
of their voices being heard than us. And so this is not to take respect away from them, but this was to make sure that we understand that the spaces that we're in, that we all live and breathe in this community. We have chosen to organize society in this way, but vote for folks, ask folks questions, hold them accountable. Holding a public office does not put us in a hierarchy. And so we do these things intentionally, not to lessen the respect due to your office, but to elevate the respect due to our community.
The book title is An American Sickness. Yeah. It's An American Sickness by Elizabeth Rosenthal. So An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. So,
All right. Thanks, folks. That's all we have for our summit. Please vote.